Hi, my name is Bill Callahan. I'm with Connect Your Community, and this is Digital Inclusion Week 2020. And since we've all been wrestling for the last 7 months with the consequences of people in our community not being connected, and we've been doing a lot of it on Zoom, I thought it would be a good idea to celebrate Digital Inclusion Week 2020 by having conversations on Zoom with a few of the people who've struggled for the last several years to close the digital divide in Cleveland about what we've learned from the experience of the last 7 months. So today we have Dr. Amy Sheon. Amy is the Executive Director of the Urban Health Initiative at the Case Western Reserve University School of Medicine. She's also a Senior Fellow and a Health Subject Matter Expert for the National Digital Inclusion Alliance, has her own company called Public Health Innovators, which works with community health organizations, and most important is a board member of Connect Your Community and a longtime colleague, particularly in the area of trying to make telehealth and access to online medical services equitably available to poor people in the Cleveland area. So I asked Amy to be the first of our conversations. Thanks, Amy, for joining us. And since you are our healthcare and particularly our telehealth expert, I wanted to ask you whether the experience of the last 7 months, the COVID-19 emergency, which has certainly been a health emergency in many other ways, whether that's changed healthcare providers' awareness of the digital divide.
Thank you, Bill. And first, let me say just thank you for everything you do and for what you've done for years and years, and really for mentoring me in learning this content area and how to get things done. You are an inspiration to me every day, and you have really made a difference in our community. I know you didn't ask me to say that, and you didn't know I was going to say that, and you could edit it out because I know you're so modest and humble, but I hope you'll leave it in there because you really are a digital inclusion hero. So with that, I will answer your question. Telehealth, of course, has changed absolutely everything. COVID has changed absolutely everything in healthcare. Healthcare almost overnight went to telehealth, virtual visits, and for healthcare to make that kind of move in that short of a time is really unprecedented because there's so much regulation. But unfortunately, it took several months until healthcare systems were even thinking about who is and who isn't getting access to audio video connections for telehealth. It's really taken several months. I think they were so scrambling with the reimbursement, the insurance issues, the technology, that there was no time to really think about this side of it. So they are starting to be aware that there's a problem, creation of what I call second-class care, telehealth, for people who can't have a two-way video telehealth connection, that they're having a two-way audio connection, like a phone call. And there's no question that is not as rich of an experience for either the provider or the patient as having a live synchronous two-way video. And unfortunately, many people lack the devices, the internet capacity needed, and the skills to be able to use telehealth.
So what actions are providers taking, or what could they be doing to improve that situation?
Well, I will tell you that they are starting to take action. And as you know, Bill, I have for years tried to engage healthcare systems with digital disparities and recognizing how incredibly valuable digital connectivity can be for health and for people's ability to engage with healthcare. And by and large, those pleas fell on pretty deaf ears, with the exception of Metro Health, that's really been looking at this for a long time. However, all of a sudden, the last 6-8 weeks, they've started calling me. My advice is along these lines. First of all, you got to look at it. Look at who is and who isn't able to use your telehealth. What are their demographic characteristics? Where do they live? If you've got seniors who aren't connecting, those are different issues than if you have younger people who may have some digital skills but don't have internet connectivity. So you've got to look at who is and isn't using, and then you need to go down to what are the specific barriers that people have. Are they lacking devices, connectivity, skills? Not too many are yet getting to solutions and interventions. However, those are definitely on the docket. And I would say those include giving out devices to people, getting them data plans, working with whatever the internet service provider is of the healthcare system. Use that. You know, you've got some pull with that. You're a big account. You've got some pull with them. See what you can leverage for them to serve your customers as well. And then, of course, the last thing is about training and being able to provide technical support to patients to address gap problems that they may have in using telehealth. There is one health system that posts their playbook, their telehealth playbook on the web for their providers. And it's got a page that basically says, we cannot help patients with the following issues: their devices, their internet, their email account, how to find a message in their spam filter, their cookies, their browser. And it's basically, okay, thanks, you've just given us a laundry list of all the things that patients do need help with. And so I hope that health systems won't try to invent all the solutions themselves, but instead will partner with the wonderful digital inclusion organizations around the country who have expertise in getting people connected and helping them use specific applications.